everyone. Today I am going to speak about disorders of the thyroid gland, majorly about hypothyroidism. Hypothyroidism is a condition of an underactive thyroid where your thyroid gland is not producing sufficient hormones that is required for body function. Let's know where our thyroid gland is placed. So your thyroid gland is a small butterfly shaped gland that is present below the Adam's apple in your neck or throat region. It produces thyroid hormones which are very essential for your body functions. This actually begins in the hypothalamus and in the pituitary gland. The pituitary gland stimulates it by producing thyroid stimulating hormone, which sends a signal to your thyroid hormone to produce thyroxine and triiodothyronine. So T3, T4 and calcitonin are the three main hormones that are produced by your thyroid gland. T3 is triiodothyronine, T4 is thyroxine, and calcitonin is a hormone that is required for the regulation of the levels of calcium in your blood. Now we require tyrosine, that is an amino acid, and iodine for the proper functioning of your thyroid gland. In your thyroid gland, iodide is oxidized to iodine. Thyroid peroxidase is an enzyme that is required for the production of enough thyroid hormone. Now let's understand the metabolism of your thyroid gland. Well, this all begins in the brain in the hypothalamus, which produces and secretes thyrotropin releasing hormone. Thyrotropin releasing hormone then goes to your pituitary gland in the brain, where it produces and stimulates thyroid stimulating hormone. Thyroid stimulating hormone then goes to your thyroid gland, where in the presence of thyroid peroxidase enzyme, it stimulates and produces the thyroid hormone, that is T4, T3 and RT3, that is reverse T3. T4 is a major secretory product and T3 is the metabolically active form. T3, although it is produced in the thyroid gland, about 80 to 85% of it is produced outside the thyroid gland, that is in the liver and kidney. But this T4 to T3 conversion requires selenium, that is a micronutrient. Because selenium is responsible for producing 5-deiodinase. This is an enzyme that is required for the conversion of T4 to T3. Now let's know the symptoms of hypothyroidism and hyperthyroidism. Hypothyroidism is a condition of an underactive thyroid where your thyroid gland doesn't produce sufficient hormone. At that time you would observe fatigue, forgetfulness, depression, heavy menses or bleeding, dry or coarse hair, hair loss, mood swings, weight gain and hoarse voice. Whereas hyperthyroidism, that is when there is more thyroid hormone produced than what is required. At that time what you would feel is heavy sweating, weight loss, frequent bowel movements, it impairs your vision, muscle weakness, impaired fertility and difficult to get pregnant, popping or bulging eyeballs. Any disease till the time it is in the subclinical stage, it is easy for you to reverse it. That is with a proper lifestyle, with diet modification, with exercise, yoga and with healthy eating habits, you can reverse it. But once it goes above and beyond, then one has to be dependent on medicines. So make sure that you do a complete thyroid panel or a full thyroid panel test just to know the levels of these hormones. Hashimoto thyroiditis is an autoimmune condition where the cells of your immune system itself attack the tissue of the thyroid gland. This can be checked by the test, that is thyroid peroxidase antibody test, that is TPO antibody test, and thyroglobulin antibody test, that is TGB antibody test. Whenever you notice subclinical symptoms of hypothyroidism, that is low energy levels or weight gain or hair loss or coarseness of voice, tiredness, depression, I think this is the time when you have to go and get the test done. And women are more likely than men to suffer from hypothyroidism, and those with celiac disease are at a higher risk. Now let's understand the medical nutrition therapy that can play an important role in helping someone with a thyroid problem, especially with hypothyroidism. Well, iodine and selenium are two important micronutrients that help people who are having thyroid problems. Fasting and restrictive diet, that is when one is on fasting or when one has a diet that is low in calories or low in carbs, at that time it helps to boost the thyroid function. It also improves the metabolism and it reduces catabolism. Second, goitrogens. Vegetables of the cruciferous family that is cabbage, cauliflower, cassava, Brussels sprouts, broccoli, radish, mustard greens, bamboo shoots. All these have goitrins that have anti-TPO activity that inhibit the secretion of the thyroid hormone. 3. Inadequate intake of iodine impairs thyroid function, and this can cause a spectrum of disorders. You also need to take iron in addition with iodine. Iron along with iodine helps to improve thyroid function. It is a major cofactor and a stimulator for the enzyme TPO. Now please note, if you are suffering from Hashimoto's thyroiditis, then supplementing with iodine can exacerbate the condition because it improves your TPO activity, and an increase in your TPO production can cause an antibody flare-up. Iodine deficiency during pregnancy can cause congenital abnormalities, stillbirths, abortion, and also cretinism. 4. One needs to consume sufficient of iron, because if you are not consuming sufficient of green leafy vegetables or animal products, then one can also have anemia, and generally people with thyroid problem suffer from anemia. 5. You need to include diet that is rich in selenium. For example, include Brazil nuts in your diet, because selenium is required for the conversion of T4 to T3. Remember, I explained on the board that selenium dependent enzyme 5-deiodinase is required for the conversion of T4 to T3. Selenocysteine is a cofactor for 5-deiodinase, and this is very important for this activity of conversion of T4 to T3. 6 is amino acid tyrosine. Tyrosine is required by the thyroid gland. Tyrosine along with iodine is required by the thyroid gland for producing thyroid hormone. You can include pulses, especially kulith, for the requirement of tyrosine. Now all said and done, whatever I have explained today are very general guidelines. Now to decide what diet is particularly going to work for you, I need to get your blood work done, I need to check all your reports, and you need to come to me for consultation, without which it is very difficult for me to suggest a diet plan for you in particular. These things that I discussed are just general guidelines. Please make sure that you meet a dietitian before starting with any diet. I hope these points have been useful. Help somebody who's suffering from thyroid, because it's a very sad situation if you have to get up in the morning and have your Thyronorm or levothyroxine or any of these tablets and believe that you are going to have it for the rest of your life. I want that you get off the pill, but not without your doctor's permission. Please follow a healthy lifestyle, meet a dietitian, and see how she could help you with this. So you can DM me, and if you want to consult me, please either message me or let me know in the comment section or get in touch with me. I'll definitely help you out. Until next time, take care.